Hello, I'm Dr. Renee Young of Young Naturopathic Center for Wellness in Los Gatos, California. I have patients come in to see me every day wondering whether or not they have some kind of metabolic problem, like diabetes or risk for heart disease. They often would like me to differentiate for them the difference between metabolic syndrome and diabetes. If you're a person that suffers from diabetes, it means you have regularly elevated blood sugar, and it can lead to a number of problems. So diabetes comes in a couple of different forms. There's early onset, late onset diabetes, and they all have different causative factors. But diabetes is exclusively elevated blood sugar for a prolonged period of time. It's often measured by your blood glucose as well as something called your hemoglobin A1C. If you're a person that in addition to elevated blood sugar, you also suffer from abdominal obesity, high triglycerides, elevated HDL, hypertension, then that's the definition of metabolic syndrome. So the 5 factors for metabolic syndrome are elevated blood sugar, elevated triglycerides, low amounts of good quality cholesterol, hypertension, and then abdominal obesity. So if you have those 5 symptoms, you may have metabolic syndrome. Metabolic syndrome leads to heart disease. If someone develops diabetes, it will often turn into metabolic syndrome. Metabolic syndrome can sometimes result in a patient having a heart attack or a cardiovascular incident. If you have any of these risk factors, you should get your blood levels checked of your blood sugar, take a look at your triglycerides, your good quality cholesterol, and get a complete cardiometabolic workup, which is one of the things we specialize in our office. We recommend patients do this workup every 6 months. If you think this information would be of use to someone in your family or one of your friends, please feel free to share it, like it, send us your comments. And if you've watched this video and you're now wondering, do I have metabolic syndrome? Do I have diabetes? Please feel free to contact our patient care concierge. They'll be happy to give you a complimentary consultation to go over how our office works and how we can help you. At that time, they can set you up with one of our fabulous doctors that will make sure that you get your blood work checked out and you're all healthy. Be well until next time.
Thank you for watching. For more tips and free updates on how you can be well, please download our free special report, The 9 Hidden Reasons You Are Sick, Fat, and Tired, at youngwellnesscenter.com.